Good day, everyone. My name is Douglas Nechio, and I'm a registered psychologist who specializes in psychological assessments. So what is a formal psychological assessment? Well, there's different kinds. Sometimes we assess children and or adolescents to see how they're learning, to see how we can improve their functioning at school, either academically or behaviorally. These assessments are commonly known as psychoeducational assessments because they involve a cognitive component and an academic component. Quite often we look at social, emotional, and behavioral functioning as well to obtain more information about that child's behavior or pattern of strengths and weaknesses. We also do mental health assessments, which is a different kind of assessment, sometimes to look at whether or not a particular individual meets criteria for a mental health diagnosis that will then inform eligibility for services or simply put, inform treatment decisions. We do neuropsychological assessments to clarify diagnoses in children and adults as well. Two of the most common ones being ADHD assessments, so attention deficit hyperactivity disorder, and ASD assessments, which stands for autism spectrum disorder. These assessments differ in terms of what we're trying to understand about that particular individual, but there's some common overarching factors about them. Well, one of them being that a thorough psychological assessment will include measures of functioning using standardized tests, observations, direct observations, review of records and history, because we want to know the trajectory of development for that particular individual, and clinical interviews. So the more information we collect, the more comprehensive the assessment becomes, and of course, consequently, our diagnostic impressions are more defensible. So these are some of the psychological assessments we can provide, including behavioral, academic, cognitive, and mental health assessments. I hope you enjoyed this information, and we hope to see you here in the clinic. Thank you very much and have a good day.